I still remember John's astonished face, a 62-year-old patient, when I explained to him the cause behind the prostate issues he was experiencing. "Doctor, are you joking? I thought at my age things like that weren't appropriate anymore." I've encountered this reaction hundreds of times throughout my 20 years practicing as a urologist. Today, I welcome you to the podcast, Men's Health Unsilenced. I'm Dr. Michael Chen, and in the next 30 minutes, we'll break one of the biggest taboos in men's medicine, the relationship between masturbation and prostate health in middle-aged and elderly men. You might be surprised to learn that this seemingly very personal habit can profoundly affect your overall health, especially as you pass 40, 50, and beyond. Let's put embarrassment aside and explore with me the real impact of masturbation on the prostate, the shield protecting men's reproductive and urinary health. Before diving into the main topic, let's take a moment to understand the prostate, a small but powerful gland situated below the bladder, surrounding the male urethra, about the size of a walnut. This gland produces approximately 30% of seminal fluid volume and contains enzymes essential for sperm survival. Its special location is why any prostate issues can directly affect urinary ability and sexual function. But what many men don't know is that the prostate needs regular flushing to maintain optimal health. Imagine the prostate as a water faucet. If you don't open the faucet for many months, water may not flow properly. Pipes might become clogged with sediment and minerals. Similarly, the prostate needs periodic cleaning through ejaculation to remove old fluid and prevent stagnation. In my clinic, I've witnessed the consequences of neglecting this maintenance. One memorable case was a 65-year-old businessman who ignored his prostate health for years due to cultural taboos about self-stimulation at his age. The result was a severe accumulation of fluid in the prostate, leading to increased discomfort and difficulty urinating. When I examined him, his prostate was enlarged and rigid, clear signs of prolonged stagnation. Conversely, I had a 70-year-old patient who maintained a habit of self-stimulation 3 times a week, with prostate health indicators nearly identical to those of a 40-year-old man. His PSA level was low, prostate size normal, and he rarely experienced urinary issues common in men his age. The difference in vitality was striking, and he often joked that his secret was maintaining a regular schedule. Scientific studies have supported these clinical observations. A study from Nottingham University following men for over 5 years found that those who ejaculated frequently, 21 plus times per month, had significantly lower rates of prostate issues compared to those who ejaculated less than 7 times per month. The key point here is that the prostate needs regular flushing to stay healthy. Without this habit, fluids can accumulate, leading to discomfort and potential long-term damage. This isn't about like or dislike. It's about basic physiology and body maintenance. The second fascinating aspect of masturbation and prostate health relates to hormonal impact. When you ejaculate, there's a temporary drop in DHT, dihydrotestosterone levels. DHT is a powerful hormone created from testosterone, and while necessary for male development, it's also closely linked to prostate enlargement as men age. During ejaculation, DHT levels decrease, giving the prostate a mini vacation from the hormonal stress that can lead to enlargement. This works as a natural pressure release valve, allowing the prostate to recover and regenerate. In my clinical practice, I treated 2 brothers in their 50s. They had the same family history, similar diets, and physical activity levels. The main difference was that one brother regularly maintained his intimate health through masturbation, while the other believed it was inappropriate at his age. The difference in their prostate health was incredible. The brother who engaged in regular masturbation had significantly lower PSA, prostate-specific antigen, levels, an important indicator of prostate health. He also reported fewer urinary issues and had a smaller prostate on ultrasound examination, despite both brothers being in their 50s. This aligns with data from a large Harvard University study showing that frequent ejaculation was associated with a 33% reduced risk of prostate cancer. From my clinical observations, it's remarkable how few men are aware of this hormonal reset. By maintaining moderate activity, the body naturally balances hormones that would otherwise lead to issues like prostate enlargement. Many men seek expensive treatments and prescription medications to control their DHT levels, while the body actually has its own self-regulating mechanisms. Some of my patients have even been able to reduce their dosage of 5-alpha reductase inhibitors, DHT-reducing drugs, after establishing a more regular self-care schedule. Of course, I'm not suggesting that masturbation replaces medical treatment when necessary, but it can serve as a natural preventative measure and complement to treatments when needed. Sadly, many doctors avoid discussing this topic with patients due to personal discomfort or lack of training in sexual health. In reality, masturbation and hormones are part of comprehensive men's health, and it's important to openly discuss it as part of the healthcare plan. The third aspect, and perhaps the most interesting, of masturbation's impact on the prostate relates to cellular regeneration. Each ejaculation triggers a profound transformation in the prostate. Muscular contractions during ejaculation function like a pressure washer, clearing accumulated fluids and removing cellular debris. When you ejaculate, the muscles surrounding the prostate contract powerfully, creating pressure that compresses the ducts and glands. This compression process pushes out old fluids and dead cells that might accumulate in the small ducts of the prostate. Then, as the body begins producing new prostatic fluid, it brings new nutrients and other essential components for prostate cells. This isn't just theory. We've observed this process in histological studies. Prostate cells for men who masturbate regularly tend to be healthier, with fewer signs of inflammation and fewer abnormal cells. This is important because inflammation and cellular damage are precursors to many prostate pathologies, including cancer. In my practice, I find that many men over 50 believe their bodies are too old for regular self-care. They worry about societal stigma or potential judgment. But the truth is that maintaining prostate health through regular activity becomes even more important as we age. I had a 70-year-old patient who maintained a regular self-care routine with prostate indicators even better than some men in their 40s. His PSA test results were low. Ultrasound showed an even prostate structure, and he rarely experienced urinary issues common in men his age. This simple act helped ensure cellular regeneration and long-term vitality. I often compare it to changing the oil in your car. You can't keep driving with the same old oil for too long. Eventually, your engine will break down. Similarly, the prostate needs regular cleansing to keep functioning optimally. I've seen men stop this habit as they enter middle age, only to discover they've been damaging their prostate health over time. When they reestablish healthy habits, not only do urinary symptoms improve, but also their overall health and vitality. One of the most common questions I receive from patients is, "So, how often should I be doing this?" I understand this is a sensitive topic, but I believe providing specific guidelines helps men make informed decisions about their sexual health. The prostate, like any other part of the body, needs regular maintenance to function well. Based on clinical research and experience with thousands of patients, I've developed a general guide for masturbation frequency by age. For men in their 40s, when prostate issues begin to appear, a routine of 3 to 4 times per week is recommended. At this stage of life, the prostate is still relatively healthy, but early signs of enlargement may begin to show. Maintaining a regular routine can help prevent these changes from becoming more serious issues. When men enter their 50s, 2 to 3 times per week is ideal. At this age, hormones begin to change, and the risk of benign prostatic hyperplasia, BPH, increases. A memorable case was Daniel, a 53-year-old patient who maintained a schedule of 3 times weekly and saw his PSA level decrease by 15% within 6 months, along with a significant reduction in nighttime urination symptoms. Once men reach 60 and beyond, at least once a week can help maintain prostate health. I understand that physiology changes as we age, and sexual desire may decrease. However, even this minimal routine can make a significant difference in maintaining healthy urinary function. Many of my patients are concerned about aging and the impact it will have on their sexual health. But the truth is that keeping up a regular routine is vital for maintaining overall health. A 65-year-old patient of mine, a successful businessman who had previously ignored his prostate, was able to improve his symptoms and lower his PSA level by simply establishing a regular routine of self-care. However, I want to emphasize that these are guidelines, not rigid rules. Each man is unique, and it's important to listen to your body. For some, a higher frequency may feel right, while others might be comfortable with a lower frequency. The important thing to remember is that consistency is more important than intensity. A moderate, regular routine is more beneficial than an occasional painful session. Think about it like exercise. You'll get better results from short, regular sessions than from one high-intensity workout once a month. One of the most important but often overlooked aspects of prostate health is the emotional journey men experience. The feelings of shame and embarrassment surrounding masturbation are real, and they can prevent many men from maintaining a healthy routine. But this is a health issue, not a moral one. I've had many conversations with patients like Robert, a 58-year-old man who felt deep anxiety about his intimate health. He had been successful in business, but struggled with feelings of shame and fear of judgment when it came to this topic. "Doctor, I thought at my age, I should leave those things behind," he admitted during one visit. When we addressed Robert's emotional concerns and helped him understand that self-care is a vital part of maintaining health, he regained confidence. 6 months later, not only had his prostate health improved, but he also felt more comfortable with his body, leading to better overall quality of life. As I conclude this podcast, I want to share some practical recommendations. First, establish a routine based on your age. 3 to 4 times a week for men in their 40s, 2 to 3 times a week for men in their 50s, and at least once a week for men over 60. Remember, these are guidelines. Listen to your body and adjust accordingly. Second, choose a private, relaxed environment. Take your time and listen to your body. Rushing through the process will reduce its benefits. Third, complement your routine with regular exercise, a balanced diet, proper hydration, and stress management techniques. These habits will support your prostate health in the long term. The journey to prostate health doesn't have to be complex or intimidating. It's about listening to your body, understanding its needs, and acting on them consistently. By maintaining a regular routine of self-care, you're not just preventing problems, you're investing in your future vitality. If you found today's discussion valuable, please take a moment to subscribe to Men's Health Unsilenced, wherever you get your podcasts. Your subscription ensures you won't miss our upcoming episodes on other crucial but often overlooked aspects of men's health. Did something in today's episode resonate with you? Hit that like button to help our content reach more men who might benefit from this information. And if you know someone who might need this knowledge, perhaps a father, brother, friend, or partner, please share this episode with them. Many men suffer in silence because they're too embarrassed to seek information about these topics. I'd love to hear your thoughts, questions, or personal experiences in the comment section. Your engagement not only helps me create more relevant content, but also builds a community where these taboo topics can be discussed openly and without judgment. Next week, we'll be discussing the prostate diet, foods that fight inflammation. So make sure you're subscribed and have notifications turned on. Remember, knowledge is power, especially when it comes to your health. This is Dr. Michael Chen from Men's Health Unsilenced, encouraging you to take charge of your health today for a better tomorrow. Thank you for listening.